We're going to see a tutor in Toronto interacting with students at the Northern Ontario School of Medicine in Sudbury through and around the HSVO network-enabled platform. The activity is a simple tutorial around managing a patient who's been in a road accident. The learners and their tutor will be using the HSVO platform, controlling a selection of devices and services. The devices used in this demo include an open labyrinth virtual patient, a layerdle mannequin, a camera array, and a 4D anatomy visualizer. We'll start with the tutor launching the session. The learners will start with a virtual patient. They'll then be instructed to switch to the mannequin, and at a critical point they'll be redirected to interact with a camera array, showing multiple views of a surgeon who will demonstrate a clinical technique. A 4D visualizer will show a live beating heart. The tutor will then debrief the learners. So let's run the demo. The session opens with our tutor in Toronto and our learners in Sudbury. The tutor and learners log into the HSVO platform and initialize the controller. The tutor then briefs the learners and selects the scenario to run and launches it. The first part of the activity, an open labyrinth virtual patient, opens on the learner's laptop, and together they'll work through the case. At a critical point, control switches to the mannequin, and the learners have to try and resuscitate the patient who has had a major arterial bleed. As the case progresses, they need to use CPR, bag and mask, and defibrillator techniques. As the learners are unable to resuscitate the patient, they're given a quick tutorial on manual cardiac massage by a surgeon at McGill University in Montreal who specializes in this technique. To help them understand the way they need to massage the heart, the learners are shown a 4D model of the beating heart. When the learners have gone through all the options for saving this patient, the tutor ends the activity. The tutor gives feedback and discusses the case with the learners, reflecting on their performance, including ways on which future performance could be improved. With that, the session ends. Let's quickly review the demonstration. The tutor and learners are remote from each other and work through the HSVO platform. The tutor starts the session and the learners work through an on-screen case. At a critical point, the case transfers to a mannequin, requiring the learners to resuscitate this critically injured individual. As the situation gets more desperate, the learners are instructed on cardiac massage by a Quebec-based expert, and they're supported by an MRI-generated 4D model of the beating human heart. The critical dimension throughout is that the tutor and the learners have been acting as a team, working through a complex problem using a variety of simulation modalities and resources, some local, some remote. The HSVO network-enabled platform is a powerful yet simple way to connect and integrate simulation devices for healthcare training and assessment.